peak is PF Keep. Today, we will be addressing the best approach to performing dental implants, following a method which is both easy to understand and efficient in practice, and above all, one which aims for harmony in the overall treatment, a goal that we all strive towards. Harmony is something that as facilitators, you see and feel almost immediately with the Clemday approach. It is self-evident and leads to great satisfaction. Dental harmony usually refers to the smooth interaction and trust between the dentist and patient, and extended between the dentist and laboratory technician. However, the harmony I speak of is that uniting you as prosthesis creator to your armamentarium and to the fabrication process itself. This is the kind of harmony which results in superb restorations. But first, let us delve a little bit into the pertinent history at hand. 1990 saw a breakthrough in highly engineered thermoplastic polymers, first utilized in the aerospace industry. This resin was called polyether ether kitten, to be called more routinely by its acronym PEEK. The patent conditions soon allowed it to be commercialized, and in 1998, Imperial Chemical Industries advocated for the approval of PEEK as a biocompatible material for medical implants. Then, in 2016, Clemday introduced its own cutting-edge PEEK formulation into the expanding dental implant market. We called our resin PF Keep, and we continue to use it to this day with astonishing success and with a wide gamut of applications. Now, if we look carefully at its chemical makeup, you will see that it is composed numerically of hundreds of molecules, and you will notice the core consisting of 6 carbon molecules held together by single bonds. You can realize that it has 1 ether grouping and 1 kitten grouping, hence its name in chemistry, polyether ether kitten. One of the defining characteristics of PF Keep is that it sustains its molecular stability even at very high temperatures. Not until is it exposed to a temperature exceeding 300 degrees Celsius will an oral device made of this polymer begin to suffer minute deformations. In the case of PF Keep, Clemday has gone the full distance, commissioning further studies of biocompatibility under the regulated and rigorous standards of ISO 10993. This includes testing for subacute, subchronic systemic toxicity, and sensitization. The maximization test according to Magnuson and Kligman. This is in regard to permanent contact with the mucous membrane. Also included is testing for intracutaneous reactivity and acute systemic toxicity. It is important to reiterate the guarantee against subacute, subchronic systemic toxicity for 14 days following implantation, and also implantation in muscles for 7 days. So rest assured that the biocompatibility of PF Keep for the therapeutic use in your patients has been independently proven and is a fact that will allow you to fabricate any oral prosthetic device using our material and our manufacturing processes. What more can we say about the physical properties of PFKeep? Under ISO 1183 testing, its ultra-lightness is shown by its density, which is 1.31 grams per cubic centimeter, while the shore hardness test, ASTM D2240, indicates an ultra-resistance rating of 85. Its aqueous absorption, ASTM D570, is 0.5% at 24 hours, or 5 micrograms per cubic millimeters, which is just magnificent. Its resistance to flexion under ISO 178 is 125 megapascals. So just imagine if you chew something very hard, as like what happens when chewing meat and accidentally biting down hard on a bone, or when consuming the fried foods typical of Mexico, like chicharrón, pork rind. Well, it's practically impossible for anyone to fracture a restoration made with PFKeep. In fact, you could sooner crack natural jawbone tissue than a PFKeep restoration. The elasticity modulus, or Young's rating, under ISO 527-1/2 is an incredible 3,500 megapascals of pressure. But beyond such physical strength attributes, what makes PFKeep resin so truly fabulous is its plasticity, and that by way of an injected thermoplastic molding or forming process, you can fabricate virtually any oral appliance with amazing high precision results. Clemday PFKeep is available in both pellets and in disc form for you to do CAD/CAM work. PFKeep was specially formulated with dental implantation in mind, as its great advantage is the capacity for personalizing monolithic attachments, and which can be effectively shielded. This is to say that you can make a crown using Ceramer or lithium disilicate ceramic glass, as for example Clemday's own brand, Lithium YZR, reinforced with zirconium. You will confidently finish having achieved a fully biocompatible and functional prosthesis. The qualities that PFKeep offer in the production of implants cannot be matched by metal alloys or even by titanium. Axle loads, for example, transmit differently, better, because our material is a polymer. So, impression copings or structures for bridges of even up to 6 or 8 units, whether you make a first molar, a cuspid, a maxillary, lateral incisor, or a premolar, a second molar, you will always be able to shield it in lithium disilicate and add in pink Ceramer, just as you can see up here on the screen. Another important application of PFKeep is in bars for implants. It possesses qualities which other materials cannot provide. You can modify it, it has excellent resistance to compression, and it behaves exceedingly well in the matter of resilience. to any impact absorbed by the bone. This frees us from dependence on using metals and zirconium intraorally. Furthermore, the aesthetic results are truly spectacular. We now turn to how an implant is actually inserted into the patient's mouth. First, the implant fixture, which is a threaded post. This is the part which emulates a natural tooth's root system. This is screwed into the patient's jawbone and remains entirely beneath the gum line. After a few months, bone tissue begins to proliferate around the implant, as you can see in this image, growing and adhering naturally to the special surface of the fixture. This process is called osseointegration. So when this has happened, you will have to rehabilitate the implant and decide on what material to use for this. How do we rehabilitate an implant? There are implant fixtures that have an internal connection. So these in particular will need an abutment placed inside. There are also implants that have external hexagonal connections. So depending on the platform, you will choose the type of connector. Although somewhat outdated, people continue opting for them. Implants can be cylindrical in form or rectangular. There are also monolithic screw-retained implants, which are ideal, above all for the lower jaw zone, approximating the chin, which is actually the strongest part of the dental arch. You can apply torque for up to 32 newtons. There are also spherical implants available, or ball-like in form, which fit into an O-ring or socket. These can be 3.4 millimeters in diameter and have a length of up to 8, 10, or 12 millimeters, depending on the manufacturer. There are also mini implants available, which are favored in orthodontic treatments, but which are also useful for the premaxillary zone. They are very narrow because this part of the maxillary offers little buccal bone. But what there is strong enough to support such implants. What you need to take into account for the abutment is that it be pure titanium. Titanium offers the greater biocompatibility in the case of a pillar. It is friendlier to the surrounding soft tissues. There are also pillars made of nickel-chromium alloy. However, titanium is the preferred option. This type of attachment is also useful, but does not have hexagonals inside its platform. Hexagonals are normally used for bars and bridges, and this is important for you to know. Now, let us address how a rehabilitation is done. First, the implant fixture or post is screwed into the jawbone. Second, this fixture is going to receive a connector on top, the abutment. This can be made of titanium, it can be personalized, and it can be personalized using PF Keep. The third step. Upon this, you will position the visible aesthetic part, the actual prosthesis. The crown made in lithium YZR, and to which Ceramer may be added. Finally, the crown is fastened to the abutment. The orthodontist will actually take care of the chimney and have it closed. We have to think in a different way and break paradigms. And for this, you need to prepare. You need to know that implants are still being rehabilitated mainly by using metal bars, which are mainly made of titanium. This situation represents the first option that doctors request as a matter of course, although now the zirconium bar has emerged as a popular alternative. However, all these options bear substantial weight. resulting in a greater risk of fracturing while fabricating an implant. Not to mention that you will likely need a CAD/CAM, which will really elevate your operating costs. But if that expense cannot be profitably met, the alternative, which we provide, is actually very good in comparison. There are bars of a practical kind that you can effectively fabricate called the Dolder type, or also Hader, depending on the commercial brand you are using. These bars are metallic and hollowed out. They can be made in the laboratory. It is also a device which you can rehabilitate. But look at what happens if you can use the Clemday PF Keep option. You will work with two platforms, conic in shape, which some refer to as Morse locking taper connections. There are some that come with a jagged or serrated surface, while others are smooth or non-jagged. What does that mean? It means that the jagged kind have tiny recesses or fissures that allow for rotation or not. Once the two male parts are inserted into a corresponding female fitting site, they do not rotate. What I now present here are conic male parts that are non-fixative, which are rotational, for a bridge that can be shielded in PF Keep. Then you're going to mount lithium disilicate on top. A great number of the jobs dispatched to you at the dental laboratory will be monolithic cases, like the ones you see here. That is to say, you'll have a platform to which you will place an abutment. Possibly, you may be confronted by excessive bone loss and need to add a great deal of material. Do not worry about it. You will be able to shield it using PF Keep. And then place a crown in lithium disilicate. How is that all done? First, you have your metallic abutment, over top of which another attachment is put, a castable sleeve made of calcinated plastic. This is what you will place into your model. Your job as a dental technician. Condition yourself to have the resilience. Pay close attention to how you have it there. And once you have achieved that level of resilience, fit in your abutment. Afterwards, you will remove that attachment and lower it out from the model. What you can see here are small grooves or indentations which help to prevent the PF Keep from dislodging. Look at how I've placed and trimmed my plastic attachment and how I'm allowing for enough space to position and then cement the prosthesis, the aesthetic restoration, onto the abutment. And after attaching the crown to the abutment, I will utilize a resin that is both photopolymerizable and sinterable. Why? So to create. Now what you see there on either side of the restoration is Teflon tape, used as an insulator. However, you can also use petrolatum without any problem. But remember, always be sure to plug the chimney. After making your implant impression coping, you will work it as much as in its profile as its size, and in the form that you're aiming at. Now, let us summarize at this point. What we are working towards and constantly double-checking every step of the way is an attachment that will be monolithic, that will be retained to a titanium connector. But you are the one giving it form, taking your time so that in the end you will finish with a flawless and beautiful crown. After, you continue with a hexagonal platform. Now, what you are observing here, pictured, is called easy modeling. It has been tested by the doctor, who has given it extension, that it is perfect in every way, and has anatomical contouring. It has been freed from its emergence profile, And once all of the tweaks and final touch-ups have been done, you will commence with the injection. The injection will be done in a dewaxing furnace. When all the material is readied, you can inject and then recover your restoration. You can then submit it to a session of sandblasting. Then trim and finish it by polishing and buffering. As you can see, it looks great. It is completely smooth and polished. And you can now send it to the doctor with both confidence and great satisfaction. He will inspect the finished attachment and screw it in along with the platform. Notice how beautiful it is. After, you can do the crown. You can send for a trial coping as illustrated. And after, you can do it up in wax. You can send in your wax model using the very same easy modeling. Check the occlusion and then inject the crown. Once you have your crown, you can view the entire triad. The white substance is the wax up you did for your crown. Beneath it, you have your easy modeling. And beneath that, you have the abutment. What you are looking at here is already injected on the titanium platform. It's done. It is retained by the grooves that we had made. It's not coming off. Afterwards, we're going to cement the crown. Then we will carry out the engraving at 3, 5, 7, or 1% for 20 seconds. Wash it thoroughly and apply dental silane. Let this do its work for 3 minutes until evaporated. Then you can apply the self-adhesive resinous cement. You press it in the crown. Remove any and all surplus in the chimney and then photopolymerize it. And ready. You're ready for the try-in. Now we are examining a male patient, 52 years old, with an all-on-6 implant, OD 13, 15, 16, 23, 24, and 26. What did we do? We fabricated all the abutments and got them on the abutment mount with relative ease. Pay attention, for once you have it seated and it is fully static, you can see the attachments. We'll trim them and give them treatment to provide the necessary height. After, we'll do a virtual treatment prediction. If you have a program to do it, to see where all the chimneys need to be. But do not worry too much about this point. The chimneys can stay provisionally in the vestibule. We can decide afterwards, because we will cement lithium YZR or Ceramer on top. Now, strictly speaking, we made a bar with individual pillars. In your case, you're going to take yours to the patient for the try-in. After that, you will inject them, and for that, employ your dewaxing furnace. You will inject your PF Keep resin and then be able to see how your work turns out. And this is the result when injected. You'll then do your surface refinements in the sandblaster, detail, mill, and finish by polishing and buffering. Here you can see a most amazing Toronto type bar called Sudge, called so as it was presented by Dr. Brainmark in the 1970s in that Canadian city. It weighs only 7.3 grams. Yes, you heard that right, 7.3 grams. And it can be further modified by using heat if any torsion occurs. And there's little chance of that happening. So in the same way, you can make your restoration with PF Keep. and shield using lithium disilicate. Amazingly, the bar weighs only 14 grams. One bar, 11 restorations, all in lithium YZR, shielded with pink Ceramer. 11 abutments, one bar. Now that's good. This bar type Toronto, combined with PF Keep and lithium, is going to be installed into the patient's mouth. And look, just beautiful. You will be able to keep your chimneys open. And if you have a chimney in the vestibule, the doctor will do the instrumentation. Mount the bar and finalize by cementing the crown without any problems. Now, look at this 3D image and appreciate in this reconstruction the buccal bone with its implants. The 6 of them indicated by the number 1. PF Keep inside this restoration indicated by the number 2. And number 3, each individualized crown shielded in lithium disilicate, lithium YZR. Moreover, the pink Ceramer used for the gums. So to summarize, you can see the patient with his implants. His preliminary denture set came into us. We did its instrumentation. We made crowns, made PF Keep, and fabricated the bar. Clearly, we checked everything each step of the way and finalized with an all-on-6 bar, an absolutely beautiful and fully functional oral appliance. Here you have another case, a beautiful specimen, in fact, done by the Grand Master, ceramicist, and PF Keep instructor, Rodolfo Benitez. He did this rehabilitation and, as you may see, did the complete bar complex in wax. Verify for yourself the entry points where he planned to have his hygienic zones, where one could enter with a brush or water pick or periodontal instrument. Look how well he kept everything in balance, including the occlusion, and then injected. And following the injection, the result. Just consider this impressive bar, a mere 11 grams in weight. And notice the refined tunneling at the gingival edges. All the gum margin has this tunneling. Why? So that the crown may enter. And when the Ceramer is added, you finish with a beautiful bar, well worked, polished, and buffered, including instrumentation in the maxillary. Beautiful work here. The pillars, the height of the pillars, the gingival height, all of these factors are key for you to carry out successfully. Observe the left side profile and how all the space that you will need is taken into account when you apply Ceramer. That'll be up to you, your criteria to ascertain how much to add and how much to remove. The crowns are sealed. The blue resin here is your easy modeling, both sinterable and photopolymeasurable. Well done. This is an accommodation done with 2 ingots, surpassing in excellence. This is lithium YZR, lithium disilicate ceramic, reinforced with zirconia. Here it is sandblasted, part of the very same PF Keep system. Utilize our luster color kit whenever you want to characterize or make refined touch-ups. These crowns were characterized using the luster color kit. to achieve the polychromatic results you have before you. Crowns injected monolithically and featuring beautifully refined and personalized luster color kit makeup. Each tone representing a subtle layer of ceramic glass paste, specially formulated for use in any lithium disilicate restoration. And now just look at the result, unique and spectacular, all achieved by using lithium YZR and Ceramer. Afterwards, the final polishing and buffering, quite evident here. And what is most amazing, as I earlier remarked, the tunnel and fixturing in the cervical zones to disguise any signs of continuity. But there is, in fact, continuity at every point of the Ceramer, which will serve to discourage any scaling and biofilm attachment. Now notice here the overall state of the premolar zone. The chimney remains in the vestibule, but is not an issue. You can easily place a veneer in lithium YZR over it. Look now at this very important zone known as the central groove, or furrow. This is what will guide you and take you along the circumference, that cervical curve of the central dental fossa. It's that easy. The end result, finished with Ceramer and lithium disilicate. Look here. Can you see how the application of Ceramer is? Do you see how the lithium YZR is? Wow. Incredibly, this bar weighs 14 grams. And the most important thing, how well it looks in the patient's mouth. Now, what purpose do these spaces serve? That is where the water pick can enter, or any of those water pressure systems, where an interdental brush may enter. And you cannot but love the characterization of the gums. Rodolfo uses mainly white, pink, and violet. And look at how the instrumentation has been performed. So do realize why and how those spaces are left, so that the very necessary hygienic actions may be done. When checking the profile of the other side, you can see how well everything has turned out, and how the patient will be able to perform his daily hygienics. This close-up is slightly different, and with it you may see how individualized all these crowns are, as if they were genuine teeth. Look at how attractive the lithium YZR has turned out. This is an adult mouth with just a little gloss, with refinement in the profile, and a heartfelt smile. Observe the work from the other side. It looks so good that one just cannot wait to fit it into the patient's waiting mouth. This is what you can make using lithium YZR. Crowns in lithium YZR and PF Keep. What are we talking about? Polyether ether ketone. Here is another case that was sent to me recently. These are the implants as they had been positioned, placed perfectly. A rotal image showing it with the teeth. What are you looking at now? It is called a diagnostic wax-up or markup, which is the preliminary study done to confirm details, the contouring, the occlusal scheme, and to prepare the way for the accurate injection. And what do you see underneath it? This is easy modeling resin. Finally, the dentist will perform the try-in, and what do you think? The dentist will identify some final adjustments, have the patient articulate various movements, and when ready, you'll inject the material. Once it is ready, what happens next? We have here some inferior spaces that I've taken away. What I'm going to put there is pink-colored Ceramer. And to each of these pillars, you will cement a crown, resulting in a magnificent denture with enviable aesthetic. And you'll fill in all those spaces of the gingival area with Ceramer. Is it recommendable to use a guard and caliper? It just depends. Certainly, if you're going to make provisions, then use one with a caliper. This is a view from the other profile. Always tunnel, and we build the structure up, which is to say, make a step in the cervical so the crown may enter, and after, when the Ceramer shielding is placed, all this dental work will not be visible. What you're looking at here is a situation involving acrylic, which was applied on top because it was, we could say, the immediate result. That acrylic denture with acrylic teeth was what the patient had to begin with. Attention here. It was what the patient had to begin with, and which was also being used provisionally. Observe carefully. You see, acrylic is really nice to work with. When you do this type of restoration, pay close attention to how we have our chimneys. We have 1, 2, 3, 4 on the left side and 1, 2, 3, 4 on the right. You need not worry about where they end up precisely, because you'll be able to cover them over with pink Ceramer. Or even the same crown can keep its chimney, as it can actually be better to leave one. Here is the pink gum flange prosthesis, placed into the mouth, not causing any ischemia. Observe the white linear structure at the mid-posterior vestibule, called in Latin the linea vestibulis. It is where you can go in using a brush to carry out hygiene. The patient will appreciate it. And here's another view of the work model and wax up of all the crowns. Beautiful crowns, and underneath you can see the easy modeling resin. The injected crowns. Wow, this picture really speaks for itself. Placed into the patient's mouth, let us just take a peek so you can take some delight in it. All the spaces you see will be shielded and filled with pink Ceramer. Now, there should be no activation at this point. Your work must not be submitted to movements of any kind. It has to remain completely passive. And this is the end result. What more can I say? The height of the molar is perfect. There is no need to place a second one because there is symmetrical stability in the prosthesis. There you have the central incisor, the lateral, the canine, the first premolar, the second premolar, the first molar. And with them all, the patient will be able to chew his food and eat. Even bite down on bones, should he want. More than 400 megapascals biting force guaranteed with lithium YZR. 400 megapascals of resistance in the crowns and 3,500 megapascals in the PF Keep. Wow! And just look at the patient smiling, totally contented and happy with the PF Keep result. Now, here's our last case. 6 crowns, 1 half palatinized, and 6 beautiful toothed attachments. We made our crowns and shielding with this beautiful substance called easy modeling. Why do I call it beautiful? Because it is exact, it can be sintered, and these jobs, it really helps you do delicate work. If, for example, you send the doctor the model and it does not measure up during the try-in, it can be adjusted in situ at the office. The doctor can actually solder using easy modeling, gently, in the patient's mouth, and return the model back to the lab. You re-inject and will have done great work. Here are the pillars made of wax and everything finished. Here it is, all done. PF Keep. It's ready. Why, look at all those crowns. PF Keep and easy modeling with individualized crowns. Well, what do you think? The work is done. But there is a difference here. Ceramer is not actually applied here. These crowns have been acrylicized. Acrylic is a good alternative material that you can use. Here we see a little overlap with the implants above. PEEK is PF Keep.